This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
Diabetes can lead to many different complications, including your feet. Diabetic foot ulcers and infections are a common problem, so what do you need to know about diabetic foot ulcerations and infections? Let's find out with Dr. Craig Jex, a podiatrist at Dignity Health. Dr. Jex, thank you for your time. First off, can you tell us how diabetes affects our feet?
Well, the diabetes is a condition where patients have a higher than normal amount of blood glucose or blood sugar that circulates in their blood. The high blood sugar is toxic to the nerves in the feet, which causes numbness. There's a lot of theories about why that occurs, but the higher than average blood sugar causes damage to the nerves that provide sensation to the feet. It also affects circulation. This combination makes people more prone to developing sores on the foot from pressure areas. The sores can become infected. The infection can spread to the bone, and then sometimes, unfortunately, that can lead to amputation. So, obviously, prevention becomes pivotal.
So let's talk about that. Speaking of prevention, how can someone prevent these complications from diabetes happening?
Yeah, that's a great question. The number one way is to control blood sugar. Maintaining tight control over their blood sugars is by far the number one way to prevent the numbness from occurring in the first place, and if it started, to try to prevent that from worsening. And that goes with all of the complications from diabetes for the most part. In addition to tight blood sugar control, monitoring their feet closely, meaning checking top and bottom, at least once daily, looking for any break in the skin, redness, swelling, blisters, anything along those lines, and they would want to tell their doctor or a podiatrist immediately if any of those are noted, so that if something occurs, it can be the treatment can start right away.
Got it. So seek medical attention right away. So then what are the non-surgical treatment options for someone suffering from one of these diabetic conditions?
There are multiple. As a podiatrist, when I first see a patient with a diabetic ulceration or a diabetic sore, we check their circulation, multiple ways to do that, to make sure that the amount of blood flow getting to the foot is adequate to heal the sore. We'll make sure it's not infected, both through physical exam or diagnostic testing, imaging, things along those lines. And then there's different ways we use to keep the pressure off the ulcer. Getting pressure off the sore is very important to allow that to heal. And then different modalities. We have different wound care products, or even synthetic skin grafts that we can put on, things along those lines to get the ulceration to heal prior to any infection setting in. But the key points to that are assuring there's adequate blood flow to the foot, keeping pressure off that area, assuring that it's not infected, and then also removing any non-viable or unhealthy tissue from the ulcer site, a process called debridement, where we take the dead tissue off and only leave the healthy tissue behind.
So when is a surgical option called for?
It depends somewhat on the patient, whether they're a surgical candidate and what type of ulceration it is. The guidelines we'll typically follow are if the ulceration is not infected and is not threatening the foot or the leg, then we'll usually wait several weeks and try other things before entertaining any surgical intervention. If it goes several weeks without healing, then there's different procedures that can be done to try to internally take the pressure off that area, so to speak. Obviously, if ulceration becomes infected or it's threatening the leg or the limb, then you have to be more aggressive right away with surgical intervention.
What if someone doesn't call the doctor right away and says, I'm just going to live with this, or I'm just going to deal with the pain and live with this for a while? What happens then if someone doesn't get this treated?
Unfortunately, in that situation, it can lead to loss of either part or all of the foot. The whole reason we do diabetic preventative limb salvage would be to try to prevent below the knee or above the knee amputation. So avoiding treatment or trying to treat it on your own is something that can be fairly disastrous.
So don't try to treat it on your own. That sounds Like it's really important, and make sure you call the doctor right away. Earlier, you were mentioning some ways to prevent complications. Overall, are there any lifestyle changes someone can do to try to prevent these type of complications from happening?
Well, obviously, diet and exercise in conjunction with medication to control their blood sugar, different shoes that we'll put patients in to try to offload the area after we get it healed to prevent recurrence, things of that nature. But as I discussed earlier, a lot of it comes down to blood sugar control, which in addition to medications would be exercise and appropriate diet.
So blood sugar control, exercise, and diet. Lastly, Dr. Jex, is there anything we should know about diabetic foot ulcerations and infections?
Only that it's a very significant problem, and any indication that that's occurring, they should see a professional right away.
Well said, and thanks, Dr. Jex. To learn more and to get hooked up with one of our providers, visit dignityhealth.org/Bakersfield/wound care. And if you like what you've heard, please share it on your social channels, and be sure to check out our full podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.